Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's both alarming and incredibly important, one that affects young people across the United States, Europe, and around the world. Picture this. You're in your 30s, maybe a marathon runner, eating organic, taking care of yourself, and then you get a cancer diagnosis. Sounds unthinkable, right? But it's happening more and more. According to researchers at Dana-Farber Cancer Institute in Boston, young people, those under 50, are experiencing a shocking rise in certain types of cancer, especially colorectal cancer. In fact, if current trends continue, colorectal cancer will become the leading cause of cancer death in women under 50 by 2030. Today, we're breaking down why this is happening, what the science tells us, and most importantly, what you can do about it. We'll cover 3 key areas: the alarming statistics, the potential causes scientists are investigating, and the practical steps you can take to protect yourself. So stick around, hit that subscribe button for more health tips, and let's get into it. Let me start with some context that'll help you understand just how serious this situation is. Dr. Kimmy Ng, a leading oncologist at Dana-Farber Cancer Institute, has been treating gastrointestinal cancers for over 20 years. And here's what she's noticed. Each consecutive year, more and more young people with no risk factors, no genetic syndromes, are walking into her office with stage 4 colorectal cancer. These aren't just isolated cases. This is a pattern. Now, here's where it gets really interesting. If we look at all age groups combined, colorectal cancer rates have actually been declining for decades. That's the good news, and it's thanks to better screening and improved treatments. But here's the catch. That benefit hasn't reached people under 50. Since the mid-1990s, colorectal cancer rates in young people have been increasing by 2 to 3% every single year. This affects both men and women, and it's happening across the United States and globally. Let me give you a striking comparison. A person born in 1990 has 4 times the risk of developing rectal cancer and over double the risk of colon cancer compared to someone born in 1950 at the same age. Think about that for a second. 4 times the risk, just by being born 40 years later. And colorectal cancer isn't alone. Other digestive system cancers like pancreatic cancer and endometrial cancer are also rising in younger populations. Currently, colorectal cancer is already the leading cause of cancer-related death in men under 50. And as I mentioned earlier, by 2030, it's projected to become the leading cause in women under 50 as well, surpassing breast cancer. This pattern is what scientists call a birth cohort effect. What that means is the risk varies by generation. It follows people born in certain decades. And when researchers see this kind of pattern, it usually points to environmental exposures that have changed relatively recently. Now, where is this happening most? The trend is strongest in westernized, higher socioeconomic countries. Australia and New Zealand have very high rates. So do Norway, the UK, and certain countries in Western Europe. This geographic pattern gives us important clues about what might be driving these increases. So we know the problem is real, and it's growing. But what's actually causing it? Let's dig into the science. All right, so this is the million-dollar question. Why are young, healthy people getting cancer at higher rates? First, let's clear up what it's not. This isn't about human genetics suddenly changing. These increases happened too rapidly for that. However, and this is important, the younger you are when diagnosed with cancer, the higher the chance of finding a genetic predisposition. So if you're diagnosed young, genetic testing is absolutely essential. In fact, at Dana-Farber's Young Onset Colorectal Cancer Center, genetic testing is now automatic for all new patients. But for the broader population trend, scientists are looking at environmental and lifestyle factors. And the leading hypothesis? Obesity. Now, before you jump to conclusions, let me walk you through this carefully because it's not as simple as it sounds. Obesity rates have skyrocketed in recent decades, paralleling the rise in young onset cancers. And we know that gastrointestinal cancers are strongly linked to obesity at any age. Here's why. In a state of obesity, there's increased inflammation in the body. And inflammation is a known precursor to many different types of cancer. There's also the microbiome, the trillions of bacteria living in your gut. We're learning more every day about how the microbiome plays a role in immune surveillance against cancer, and potentially how it might contribute directly to cancers like colorectal cancer. Beyond obesity, several other dietary and lifestyle factors have been linked to increased risk of young onset colorectal cancer in prospective cohort studies. Sedentary behavior, not moving enough, high intake of sugar-sweetened beverages, what researchers call a Western pattern diet, diets high in red meats, processed foods, and sugars, but low in fruits and vegetables. All of these factors show associations with increased risk. But, and this is a big but, Dr. Ning emphasizes something crucial. Most of the young patients walking into her clinic are not obese. Many are marathon runners, triathletes, eating organic, living seemingly healthy lifestyles, and yet they're still being diagnosed. So what's going on? Here's where the science gets really fascinating. It might be early life factors that matter most. Think about it. If someone comes into the clinic at 35 with cancer, how do you find out what they were eating at age 6 or how much physical activity they got at age 7? It's nearly impossible to remember. A recent paper published in the prestigious journal Nature found something remarkable: 3 times more prevalence of a specific mutational signature in young onset colorectal cancers. This signature is caused by a genotoxin called colobactin, which is produced by a microorganism called PKS-positive E. coli. Here's the key. If this bug is in your microbiome in the first decade of life, producing this genotoxin, it can damage your DNA in a characteristic way that may increase cancer susceptibility later in life. This is why Dr. Ning believes we need to understand what's happening early in life. What dietary and environmental exposures in childhood might be setting the stage for cancer decades later. Now, I want to be completely transparent here. Scientists don't have definitive answers yet. These are observational studies showing associations, not necessarily causation. We're still in the early stages of understanding the true biological mechanisms, but the research is pointing us in important directions. Okay, so we've covered the sobering statistics and the scientific theories. Now, let's talk about what you can actually do about this. Let's start with screening, because this is truly life-saving. The current gold standard recommendation is that everyone at average risk should start colorectal cancer screening at age 45. This was recently lowered from age 50 based on modeling studies by the U.S. Preventative Services Task Force. Now, you might be wondering, why not screen even younger if rates are rising? Here's the thing. While rates are increasing rapidly, the absolute number of cases in very young people is still relatively small. Screening programs have to balance effectiveness, cost, and risks. Right now, the data supports screening starting at 45 for average-risk individuals. But here's an important point. Talk to your family about family history. If you have a family history of colorectal cancer or even advanced polyps, you may qualify for earlier screening. This could be life-saving. Now, what does screening actually involve? Dr. Ngu says the best screening test is the one that actually gets done. You have options. Colonoscopy, the gold standard. If it's clean, you're good for 10 years. The huge benefit? If they find polyps, they can remove them right then and prevent cancer from ever developing. Stool-based tests. These you can do at home. You get a kit in the mail, collect a sample, send it back. Tests like FIT, fecal immunochemical tests need to be done yearly. Tests like Cologuard, which incorporates molecular changes, can be done every 3 years. CT colonography, also called virtual colonoscopy, using a CT scan of your colon. Stool-based tests are almost as good as colonoscopy for early detection, but not quite as good for prevention since they don't catch polyps as effectively. Here's a sobering statistic. Only about 25% of people between ages 45 and 49 are getting screened. Even in the older population where screening have been recommended longer, only 66% of people over 50 are getting screened. There's been a push to get 80% of the US population screened, but we haven't reached that goal yet. One colonoscopy can significantly decrease your lifetime risk of developing colorectal cancer. When you weigh that against the alternative, surgery, chemotherapy, radiation, the prep and procedure are nothing. Knowing the warning signs. Beyond screening, you need to know the red flag symptoms. For young people, most of these cancers arise in the left side of the colon or rectum. The most common presenting symptoms are
1. Blood in the stool, especially if it's mixed into the stool rather than just on the toilet paper. 2. Change in bowel habits, new diarrhea or constipation that's different from your baseline. 3. Thinner caliber stools. 4. Abdominal pain. 5. Fatigue or shortness of breath with exertion, which could indicate anemia. 6. Unintentional weight loss. Here's the problem. Nobody is comfortable talking about their stool. There's stigma around bowel health, and this varies by culture and gender. Women may feel more uncomfortable discussing these symptoms than men, but we need to normalize these conversations. Young people experience much longer delays in diagnosis, which may be why most are diagnosed with late-stage disease, stage 3 or 4, which are significantly less curable than stage 1 or 2. If you have persistent symptoms, especially blood mixed into the stool that's not getting better or is getting worse, take it seriously and get it worked up. Lifestyle factors. Even though many patients with young onset cancer are living healthy lifestyles, these factors still matter, especially early in life. Promote an active lifestyle. Eat a healthy diet rich in fruits and vegetables, lower in red meat and processed foods. Reduce sugar-sweetened beverages. Maintain a healthy weight to reduce inflammation. Don't smoke. Limit alcohol consumption. These recommendations align with guidelines from the CDC and USDA MyPlate recommendations. While we don't have all the answers yet, these evidence-based steps can reduce your risk. Before we wrap up, let me address an important disparity issue. There are significant disparities by race and ethnicity in colorectal cancer rates and outcomes. Non-Hispanic Black populations have 20% higher incidence of developing colorectal cancer, and when they do get it, it's at a younger age. They also have a 40% higher mortality rate compared to non-Hispanic white populations. Part of this is due to disparities in screening uptake. This is why public health efforts need to reach every community, church communities, cultural organizations, workplaces, to advocate for the life-saving potential of screening. Everyone deserves access to information and screening, regardless of background. All right, let's wrap this up. Here are your key takeaways. 1. Colorectal cancer rates are rising dramatically in people under 50, with a person born in 1990 having 4 times the risk compared to someone born in 1950. 2. Scientists suspect environmental factors, possibly obesity, diet, and early life microbiome exposures. But the mystery isn't fully solved yet, especially since many patients are healthy and fit. 3. Everyone should start screening at age 45. Talk to your family about family history, which might qualify you for earlier screening. 4. Know the warning signs, especially blood in the stool, changes in bowel habits, and persistent symptoms. And 5, live a healthy lifestyle, especially in childhood and early adulthood. It matters. If you found this information valuable, please share it with friends and family. Hit that subscribe button and the notification bell for more evidence-based health tips. And here's my question for you. What's stopping you from getting screened? Drop a comment below. Let's normalize this conversation. Remember, the information in this video is for educational purposes only and is not a substitute for professional medical advice. Always consult your doctor before making any changes to your health routine or if you have concerning symptoms. Thanks for watching, and I'll see you in the next one. Stay healthy. Important notice. The information provided in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or health concerns. Never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. If you think you may have a medical emergency, call your doctor or emergency services immediately. The content presented here is based on scientific research and expert interviews, but individual health situations vary, and only your healthcare provider can give you personalized medical guidance.